What if the reason your blood sugar is still running high has nothing to do with what you're eating? What if it isn't because you're taking the wrong medication either? What if the missing piece is something most people never think about: the way you drink water every single day? I know that probably sounds too simple. In fact, if someone had told you that years ago, you might have dismissed it immediately. After all, you've likely spent years trying to manage your diabetes. You've watched your diet, taken your medications as prescribed, checked your blood sugar, and done your best to follow your doctor's advice. So the idea that something as ordinary as drinking water could make any real difference almost sounds impossible. But stay with me for a few minutes. Over the years, I've seen this one small change make a meaningful difference for many older adults living with diabetes. Not because it replaces medication, not because it's a miracle cure, but because it helps the body work the way it's supposed to. And in some cases, people began noticing improvements within just a few weeks after changing one simple daily habit. Here's what's even more surprising. The biggest mistake usually isn't how much water people drink, it's when they drink it. That timing can have a much greater impact than most people realize, especially after the age of 60. So before you decide this can't possibly apply to you, I encourage you to watch until the end. The timing strategy I'm going to share is the part that many people overlook, and it may completely change the way you think about something you've been doing your entire life. My name is Dr. Lee, and for many years I've had the privilege of caring for adults living with diabetes. I've worked with people from all walks of life, and while every patient is different, I've noticed something they often have in common. What stays with me isn't a lab report or a blood sugar reading. It's the look in someone's eyes after they've been trying so hard to do everything right. They've changed the way they eat. They take their medications every day. They check their blood sugar faithfully. They keep showing up for appointments, hoping the next visit will finally bring better news. But too often, the numbers still aren't where they want them to be. I understand how discouraging that can feel. It's frustrating to put in so much effort and wonder why nothing seems to change. Over time, that frustration can turn into worry. Then it becomes exhaustion. Some people even start asking themselves if they're doing something wrong, despite following every recommendation they've been given. If you've ever felt that way, you're certainly not alone. That's one of the reasons I wanted to make this video. Everything I'm going to share comes from real conversations and real experiences with patients I've cared for over the years. These are observations that have stayed with me because I've seen how small, practical changes can sometimes make a meaningful difference. My goal today is simply to share one of those observations with you in a clear and practical way, so you can better understand something that many people never think to ask about. Over the years, one pattern has stood out to me again and again. Many adults over the age of 60 are living with mild, ongoing dehydration without ever realizing it. They don't necessarily feel thirsty. They don't think anything is wrong. So they assume they're drinking enough water when, in reality, their bodies may not be getting the hydration they need. That raises an important question. Could this be one of the missing pieces that makes blood sugar so much harder to control? It's a question worth thinking about because most conversations about diabetes focus on the same topics. We talk about carbohydrates, we talk about medications, we talk about exercise. Those are all important, and they deserve attention. But there's one area that often gets overlooked. Very few people stop to think about how their body is actually being hydrated throughout the day. Not just how much water they drink, but whether their body is getting the right support at the right times. I've found that this simple detail is often missing from the conversation. And when it's overlooked, it can become easy to focus on everything else while ignoring something much more basic. Before we move any further, I want you to keep this one idea in mind. Sometimes the biggest obstacle isn't always the thing everyone is talking about. Sometimes it's the one thing almost nobody thinks to ask. Before we go any further, I'd love to know where you're watching from. Take a moment and leave your city or state in the comments below. I always enjoy seeing people from all across the country joining these conversations, and it helps build a community where we can learn from and support one another. Now, let's get into the most important part. Now, let me be clear about something. This is not a cure for diabetes, and it's not a shortcut that replaces healthy eating, exercise, or the medications your doctor has prescribed. Instead, this is about understanding how your body changes after the age of 60, and why those changes may affect your blood sugar more than you realize. The first change is that your body simply becomes less efficient at holding onto water. As we get older, our cells don't stay hydrated as easily as they did years ago. Even if you're drinking what seems like enough water, your body may not be using it as effectively. The second change involves your kidneys. As part of the normal aging process, kidney function changes over time. That can affect the way your body manages fluids throughout the day, making it easier to become mildly dehydrated without noticing any obvious symptoms. The third change is something many people never think about. Your sense of thirst naturally becomes weaker with age. By the time you actually feel thirsty, your body may have already been running low on water for quite a while. That means you can't always rely on thirst as a signal that it's time to drink. The fourth change is related to medication. Many older adults take one or more prescription medications every day. Some of these medications can increase the risk of dehydration, making it even more important to pay attention to daily hydration habits. When you put these four changes together, a pattern begins to emerge. Your body may not be getting the hydration it needs, even though you're doing your best to stay healthy. So why does that matter for blood sugar? Because insulin works most effectively when your body's cells are properly hydrated. When those cells aren't getting enough water, they may not respond as efficiently. As a result, blood sugar can become harder to manage, even if you're eating the same meals, taking the same medications, and following the same daily routine. That's why two people can follow a very similar diabetes plan and still see different results. Sometimes the missing piece isn't another medication or a stricter diet. Sometimes it's simply understanding how the body changes with age and making sure those changes aren't working against you. Let me tell you about one of my patients. We'll call him Robert. Robert was in his late 60s and had been managing his diabetes fairly well for years. He understood his condition. He followed his treatment plan. His blood sugar wasn't perfect, but it had been reasonably stable for a long time. Then something changed. His morning blood sugar readings started creeping up. At first, it happened only once in a while. Before long, it became a regular pattern. Even though he hadn't made any major changes to his daily routine, his numbers were consistently higher than they had been before. Naturally, we started looking for answers. The first thing we reviewed was his diet. We went through what he was eating, meal by meal. Nothing significant had changed. Next, we looked at his medication. He was taking them exactly as prescribed. We also talked about his daily routine, his activity level, and the habits that often affect blood sugar. Again, everything seemed remarkably consistent. At that point, it would have been easy to assume that his diabetes was simply getting worse with age. But something about his situation didn't quite fit. So I kept asking questions. Instead of focusing only on food and medication, I wanted to understand what a typical day looked like from the moment he woke up until he went to bed. As we talked through his daily routine, one detail slowly became clear. Robert wasn't drinking very much water. He didn't think it was a problem because he rarely felt thirsty. He believed he was drinking enough to get through the day. But when we looked more closely at his habits, it became clear that his body was spending much of the day in a mildly dehydrated state without him ever realizing it. That small detail had never seemed important to him. In fact, it had never come up in most of the conversations he had about managing his diabetes. That's when I suggested a simple approach that I now refer to as the WTR Protocol. I didn't ask him to change his medications. I didn't tell him to follow a completely different diet. Instead, we focused on changing one everyday habit in a more intentional way. I'll explain exactly what the WTR protocol is in just a moment, but before I do, there's something even more important to understand first. Many people unknowingly make the same mistakes with hydration every single day. Unless those mistakes are corrected, even the best plan may not work as well as it should. About 10 days later, Robert came back for a follow-up. One of the first things he told me was that his morning blood sugar readings had started moving in the right direction. The change wasn't dramatic overnight, but the numbers were becoming more consistent. That alone was encouraging. He also noticed something else. He had more energy during the day. He didn't feel as sluggish in the morning, and he said his mind felt clearer than it had in quite some time. Those changes mattered just as much to him as the blood sugar readings. What makes this story so interesting is that we hadn't added a new medication or introduced a complicated treatment. We had simply changed one basic daily habit in a more intentional way. So that raises an important question. If something this simple can make a difference for some people, why don't more people experience the same results? The answer often comes down to a few common hydration mistakes that many adults make without even realizing it. So, if hydration really matters, why don't more people see better results? In my experience, it's usually because of a few very common mistakes. They're easy to make, and most people don't even realize they're making them. The first mistake is believing that coffee, tea, or other beverages can completely replace plain water. Now, I'm not saying you have to give up your morning coffee. Many people enjoy it, and that's perfectly understandable. The problem is assuming that every drink provides the same kind of hydration. Throughout the day, it's easy to think, I've had several cups of coffee and a few other drinks, so I've probably had enough fluids, but that isn't always the case. When plain water becomes an afterthought, your body may never receive the steady hydration it needs. The second mistake is drinking very cold water immediately after waking up. Many people reach for a glass of ice water first thing in the morning because it feels refreshing. But after your body has gone through an entire night without drinking anything, it may respond better to a gentler approach. Giving your body water in a way that feels comfortable can make it easier to begin rehydrating after several hours of sleep. The goal isn't to shock your system, it's to help your body ease into the day. The third mistake is waiting until you feel thirsty before you drink. This is probably the most common mistake I see, especially in older adults. As we talked about earlier, your sense of thirst naturally becomes less reliable with age. If thirst is the only reminder you rely on, your body may already have been running low on water for quite some time. Then, when you finally do drink, it's common to drink a large amount all at once, hoping to make up for lost time. The problem is that hydration doesn't work that way. Your body benefits much more from consistent hydration throughout the day than from trying to catch up all at once. It's not just about getting water into your stomach. It's about giving your body the opportunity to use that water effectively. When you look at these three habits together, you can start to see a pattern. None of them seem like major mistakes on their own. In fact, many people would consider them completely normal. But over time, these small habits can work against your body's ability to stay properly hydrated. And that's exactly why simply telling someone to drink more water often isn't enough. The real question isn't only how much water you're drinking, it's whether your body is receiving and using that water in the most effective way. That's where the approach I shared with Robert becomes important. Rather than focusing only on quantity, it follows a simple system that helps make hydration more intentional. I call it the WTR Protocol, and once you understand how it works, you'll see why timing and consistency matter just as much as the water itself. This is why I use what I call the WTR Protocol. It's not a trick, a fad, or a quick fix. It's simply an easy-to-remember system built around three practical principles that work together. The goal isn't to drink as much water as possible. More isn't always better. What matters is helping your body make better use of the water you already drink. The WTR Protocol focuses on three simple things. First, choosing the right kind of water for everyday hydration. Second, drinking it at the right times throughout the day. And third, giving your body time to gradually adjust to those changes instead of trying to do everything at once. Each step is simple on its own, but when you combine them, they create a routine that is easier to follow and more effective than simply telling yourself to drink more water. Let's go through each part, one step at a time. Let's start with the first part of the WTR protocol. The letter W stands for water itself. At first, this may seem obvious. Water is water, right? But when we talk about daily hydration, it's worth paying attention to the type of water you're drinking. The goal is to choose water that supports normal hydration and contains the natural minerals and electrolytes your body uses every day. You don't need anything expensive or complicated. This isn't about buying specialty drinks or chasing the latest health trend. For most people, keeping a simple, reliable source of good quality drinking water available throughout the day is all that's needed. The easier it is to reach for water, the more likely you'll build a consistent habit. Natural minerals and electrolytes play an important role in helping your body maintain normal fluid balance. That's one reason why the quality of your hydration matters, not just the quantity. At the same time, don't overthink this step. The WTR protocol isn't built around finding the perfect water. It's built around creating a routine that you can realistically follow every day. A simple habit can make all the difference. Keep fresh drinking water where you'll see it. Refill it regularly. Make it part of your daily routine instead of something you only think about when you become thirsty. Once you have that foundation in place, the next step becomes even more important, because choosing the right water is only part of the picture. Knowing when to drink it is where many people begin to notice the biggest difference. Now let's move to what I believe is the most important part of the WTR protocol. The letter T stands for timing. In my experience, this is the part that surprises people the most. Many assume that hydration is simply about drinking enough water by the end of the day. But when you drink, it can be just as important as how much you drink. The first important window is right after you wake up. Your body has gone several hours without fluids while you were asleep. Starting your morning with a glass of water helps begin the process of rehydration before you move on with the rest of your day. Think of it as giving your body a fresh start after a long overnight break. It's a simple habit, but it's one that many people skip because they're focused on coffee, breakfast, or getting out the door. The second window is before your meals. Rather than waiting until you're halfway through eating, make water part of your routine before you sit down at the table. This helps prepare your body before food arrives. It's a small change that fits naturally into your day and is much easier to remember when it becomes part of your regular mealtime routine. The third window is between meals. This is where many people unintentionally fall behind. They stay busy, become distracted, and hours pass without taking a drink. Then they suddenly realize they're thirsty and try to make up for it by drinking a large amount all at once. Instead, try to keep hydration steady throughout the day. Imagine caring for a houseplant. You wouldn't forget about it for hours and then pour an entire bucket of water on it all at once. Small, consistent care usually works much better than waiting until there's a problem. Your body responds in a very similar way. The fourth window is in the evening, a few hours before bedtime. This isn't about drinking large amounts of water right before going to sleep. The goal is simply to avoid reaching the end of the day already behind on hydration. Giving your body adequate fluids earlier in the evening helps complete the day without forcing you to catch up at the last minute. Notice that none of these steps are complicated. They don't require special equipment or major lifestyle changes. They simply create a rhythm that works with your body's daily routine instead of against it. I've had many patients tell me that this was the first time anyone had ever talked to them about hydration in this way. They had spent years paying close attention to what they ate and what medications they took, yet no one had explained that the timing of hydration could also deserve attention. That's why timing is such an important part of the WTR protocol. It's not about drinking more whenever you happen to remember. It's about giving your body consistent opportunities to use water effectively throughout the day. For many people, that's the piece that had been missing all along. The final part of the WTR protocol is the letter R, which stands for regulation. This simply means giving your body time to adjust. Even a healthy change doesn't always produce immediate results. Like many habits that support long-term health, hydration works best when it's consistent and allowed to become part of your daily routine. One thing some people notice during the first several days is that they need to urinate more often. If that happens, don't be surprised. For many people, it's simply part of the body's adjustment process as hydration habits begin to change. In most cases, this doesn't last forever. As your body becomes more accustomed to a steadier pattern of hydration, many people find that things gradually settle into a more comfortable routine. That's one reason I encourage patients not to judge the process too quickly. It's easy to expect dramatic results after just a day or two, but lasting improvements rarely happen overnight. The goal isn't to force your body to change all at once. The goal is to give it a consistent routine that it can adapt to over time. Be patient with the process. Small changes repeated every day often lead to more meaningful results than big changes that only last for a short time. That's exactly what the regulation step is designed to encourage: a steady routine that your body can gradually adjust to, one day at a time. So, what can you realistically expect after making these changes? The first week is usually a time of adjustment. Your body is getting used to a new hydration routine, so don't expect dramatic changes overnight. The most important thing during this stage is simply staying consistent and giving your body time to adapt. By the second week, some people begin to notice that their blood sugar readings feel a little more stable. The changes are often gradual rather than dramatic, but small improvements can be encouraging. They suggest that your body is responding to the new routine. Over the following weeks, some people also notice other positive changes. They may feel like they have more steady energy during the day. They may wake up feeling a little more refreshed or find that their thinking feels clearer than before. These are the kinds of small improvements that often make it easier to stay motivated. At the same time, it's important to remember that everyone is different. Some people notice changes sooner, while others need more time. There isn't a single timeline that applies to everyone, and comparing your progress to someone else's usually isn't helpful. The key is to stay patient and keep following the routine. Long-term habits almost always produce better results than searching for a quick fix. In my experience, consistency is far more valuable than expecting immediate results. Small improvements, repeated day after day, are what often lead to meaningful changes over time. I'd like to share one more story with you. This one is about a patient we'll call Linda. When Linda first came to see me, she was worried. At her previous appointment, she had been told that if her blood sugar didn't improve, insulin might be the next step. That possibility weighed heavily on her. She felt like she was doing her best. Yet the progress she hoped for just wasn't happening. We talked through her daily routine, just as we had with Robert. Instead of making major changes all at once, we focused on the same simple approach. She began following the WTR Protocol one step at a time. There was no pressure to be perfect. The goal was simply to build a routine she could maintain every day. At first, the changes were small. She became more aware of when she was drinking water instead of only thinking about how much she drank. She stayed consistent with the routine and gave her body time to adjust instead of expecting immediate results. As the weeks passed, she began noticing gradual improvements. Nothing happened overnight, and there wasn't one dramatic moment when everything suddenly changed. Instead, each small step seemed to build on the one before it. That steady progress gave her confidence to keep going. After several months, her follow-up results showed meaningful improvement. Her A1C had moved in the right direction, and at that point, she no longer needed to move forward with insulin as had once been expected. For Linda, that was an enormous relief. Now, it's important to understand why I'm sharing this story. It isn't to suggest that the same outcome will happen for everyone. Every person is different, and every diabetes journey is unique. The reason I remember Linda's story is because it reminds me of something I've seen many times over the years. Sometimes the changes that seem almost too simple are the ones we overlook the most. And when those small habits become part of a consistent daily routine, they can create a strong foundation for meaningful improvement over time. That's exactly what the WTR protocol is meant to do. Not offer a miracle, but help support the healthy habits that many people already have by making one basic part of their daily routine more intentional. Before we finish, I'd like to leave you with one important reminder. Everything we've discussed today is meant to support your overall diabetes care. It is not a replacement for medical treatment, and it should never be used as a reason to stop taking your prescribed medications or change your treatment plan on your own. If you have heart disease, kidney disease, or you're taking diuretic medications, it's especially important to talk with your healthcare provider before making significant changes to your daily water intake. Your doctor understands your medical history and can help you decide what is appropriate for your individual situation. It's also important to remember that more water is not always better. The goal is steady, appropriate hydration, not drinking excessive amounts in a short period of time. If something doesn't feel right or you have concerns after changing your routine, don't ignore those signs. Reach out to your healthcare provider and discuss what's happening. The WTR protocol is built around balance, consistency, and common sense. When it's used as part of an overall care plan, it can become one more healthy habit that supports the work you're already doing with your medical team. As we wrap up, I'd like you to remember one simple idea. Sometimes the biggest improvements begin with the smallest daily habits. If you decide to try this approach, be patient with yourself. Stay consistent, Pay attention to how your body responds, and continue working closely with your doctor as part of your overall diabetes care. Thank you for spending your time with me today. I hope this discussion has given you something practical to think about. If you found it helpful, I'd love to hear from you. Share your thoughts or your experience in the comments below. I read as many of them as I can, and your story may encourage someone else on a similar journey. Take care of yourself, and I'll see you in the next video.